everyone is ready, we can start to kick it off. Hi, hello, everyone. Welcome to our Master's in Bioethics and Medical Humanities session for today. I'm your host, Sam Hamilton. I am the Assistant Director of Enrollment Management for the School of Medicine, and I am here to be able to help with any questions and things like that that the program can answer. Mostly it's like financial aid stuff, but happy to help in however capacity I can. But today's agenda is going to cover Case Western Reserve School of Medicine. We're going to talk about the actual MA in Bioethics and Medical Humanities, and then we're going to get to the meat and potatoes of today's presentation, which is about the experiential learning opportunities that we offer through the program. I'm really excited to hear more about that. And then we're going to talk a little bit about the application process and our deadlines, and then we can get into a Q&A if anyone has any questions. So the most important thing is how to submit questions. So if you're on a desktop, it'll either show up on the Zoom bar at the top or bottom of your screen, depending on how you have it configured. It'll look like two little chat bubbles that are like in an anime, so anime apparently. So you can definitely submit them through there. If you're on a mobile device, though, you're going to want to go to the top left of your screen. There'll be 3 lines. You'll click that. It'll drop down and it'll say Q&A, and that way you can start submitting all your questions that way. And you can submit them at any point throughout the presentation. We're going to save most of them for the end, but if we see something that fits with what we're currently talking about, we of course will answer it at that moment in time. And then now I will let the panelists introduce themselves. I don't know if Leah, you want to kick off, or Roselle?
I can go ahead and jump in. So I'm Dr. Leah Jeunnette. I'm the Assistant Director of Education and a Senior Research Associate in the Department of Bioethics. I work a lot with prospective students and the incoming students. I also teach in our master's program. And I'm also a clinical ethicist at University Hospitals, which is one of the local hospitals here in Cleveland. You'll actually hear us talk a little bit about it. So I fill many different roles, but I'm excited to talk to you guys today about the experiential learning opportunities. One of the kind of focuses I'll be talking about is the clinical ethics rotations and a little bit about our study abroad opportunities. And Roselle, I'll hand it off to you to introduce yourself.
Thank you. My name is Roselle Ponsaran. I'm the Assistant Director of Research in the Department of Bioethics. And I have been in the department for a long time as a research assistant, working on a variety of research projects. And now I continue in that role, helping to coordinate different research projects that are going on with different faculty, and having the students help out with those as well. So I'll be talking about those opportunities later on.
So I can start us off talking a little bit about Case Western Reserve and specifically our School of Medicine. So we're positioned in a really great place within Case Western Reserve University and the School of Medicine, our Department of Bioethics that is, and the master's program. So, rankings, play different roles when you look at schools and colleges and those things. But our position at the university is great. Our School of Medicine is ranked #1 in Ohio according to the U.S. News and World Report. And we're in the top 25 for medical research and medical education. And it really positions us well in terms of research opportunities. Our faculty and staff participate in a lot of grants and research projects, which Roselle specifically participates in and helps coordinate and all of that. And she can speak in much more detail than I can. But not just our School of Medicine, but the other schools across Case Western Reserve, including the Mandel School, which has the Masters of Social Work program, the nursing school here, including the Doctorate of Nursing program, the Health Law program. They're all ranked very highly in comparison across the country. The Doctorate of Nursing program, I believe, is in the top 10. The Master of Social Work program is ranked very highly. And so, we collaborate a lot within our School of Medicine with the hospitals here in Cleveland, but also with other schools at Case Western Reserve as well. And so it positions us really well because bioethics and medical humanities is such an interprofessional, interdisciplinary field. And so it really bodes well for what we do in our department and across the university. So one of the big questions that often comes up is, why study bioethics and medical humanities? And, you know, if you would have asked me this question 3 years ago, I think, you know, this was a much more complex question. I think people weren't as aware of bioethics and medical humanities unless you were in healthcare or in these kind of worlds. The pandemic has changed a lot. I think people are much more aware of the complexity in healthcare. It's changed a lot of discussions on who has access and how we answer some of the questions you're seeing on the screen. But constant advancements lead to big questions. And because of that, we ask questions like, should we intervene? And then how do we intervene? And things like, can we ensure justice and respect for persons in research and clinical practice? And if we're going to do that, how do we go about doing that? And how we go about doing that is very much up for debate, and who does it in the process and the timeline and stuff is very, very challenging. And then lastly, what kind of values should inform policy and practice, both on a clinical side, but also on a research side? You know, both at the local, the national, and the international level, can be very, very challenging. And so bioethics and medical humanities plays a central role in how we address these questions, and even who gets to answer these questions, who is at the table to participate in these discussions to begin with. Is important. And so these are some of the things that we think about in bioethics and medical humanities, and just a small sampling of the big questions that we approach and we think about in these worlds. And so then ultimately it leads to the question is, how does bioethics and medical humanities help your career path, right? And as I mentioned before, bioethics and medical humanities is such an interprofessional and multidisciplinary fields, both in their origin and in their practice. And so because of that, it positions us really well to help launch students into a variety of professional careers. So students enter our program and they may have the intention to go into the clinical profession, which could be a multitude of things. It could be medicine, it could be nursing or social work. It could be legal professions. It could be going to law school or becoming a lawyer or working in the health policy space. It could be going on to do work in research or the regulatory world, arts and humanities. It could be actually going into bioethics or public health or other academic professions. And then, you know, there's a large segment of students who come in looking for just the space to work through being undecided and really taking the time to be discerning about where they want to go, and to think through it. You know, our program is designed to give students the opportunity to consider a lot of different options, and that's because of being interprofessional and multidisciplinary, that it gives students the space and the capacity to consider a lot of different areas, but also figure out what they're interested in, what they're passionate about, and how do they make that happen? How does that become a career beyond the program? And it's done for students who do the program full time, it does that in a year's time frame. But that's one of the great things about bioethics and medical humanities. You know, Roselle, you know, one of the areas that students can go on to is research and regulatory work. I wonder if you have, you know, anything to add for students who do our program and go on to research and regulatory work, if you're aware of students who have kind of gone into that world.
I believe some students have gone into that world and have expressed a lot of interest in exploring the different areas of research that they can go into. They might have come from a more science-oriented field and gone into something more in the social sciences or in other areas. So I think that reflects back on what you were saying. This interdisciplinary department has allowed people to explore all these other options and to see that research can involve all these different disciplines.
Yeah. So speaking of our program, we are celebrating currently our 26th year. We have been around for a while, and I think it makes us one of the best programs. It really helps us to fine tune what makes our program great. So for students who do our program full time, they're able to complete it in 2 semesters. So you start in the fall and you graduate after the end of the spring semester. So some of the big highlights of our program you can see here. We're going to talk next about some of the experiential learning highlights in more detail. But just some of the basic highlights. So personalized advising for each student. So you're assigned an academic advisor to really think through what you want to get out of the program, what electives can be utilized to customize the curriculum to help launch you into that professional career or the next phase of your education to get you to that professional career. And really, it's almost half of the credits that you're going to be taking are electives. And I know half is technically 15 out of 30, but if you include the capstone paper you're going to write, that topic is actually chosen by you. And so it really does come out to basically half is really focused on the topics you want to learn and dive into. We have something called student assistantships. So these are quite competitive, but they're a way for students to get involved in teaching opportunities, research opportunities, administrative assistant opportunities to help offset tuition. It's a partial tuition waiver. And if you're interested in learning more, you can always contact us about that. We're not going to focus too much on that today. We have 2 optional concentrations in our program. One is medicine, society, and culture. The other is research ethics. These are 2 ways that you can specifically dive into very specific areas within the program. They're going to really focus your electives in those specific areas and give you really a deep dive into either medicine, society, and culture or research ethics. They give students a great opportunity, great access to those faculty that focus in those areas and have expertise in those areas. And then you walk away with great knowledge of those concentrations. And then lastly, we offer dual degree programs as well. So we have an MD, MA dual degree, a JD, MA, MPH, MA. There's a whole host of others. You can learn more about this on our website. The key to the dual degree programs is you have to apply to each of the programs independently of each other. And if you gain acceptance to each of the programs independently, then you would be considered part of those dual degree programs. So let's really talk about kind of the meat of the focus for today's webinar is that the experiential learning opportunities. So we're going to talk first about the clinical ethics rotations, and then we'll get into kind of the research skills, research opportunities within the department, and then briefly talk about the short-term study abroad. So our clinical rotation or clinical ethics rotations are a fantastic way for students to kind of dive into clinical ethics at the bedside in the hospital systems. As you can see here, we have 4 hospital systems here in the Cleveland area. Case Western Reserve, the School of Medicine, the Department of Bioethics. We have a very close relationship with these hospital systems. So Cleveland Clinic, Metro Health, the VA, the Cleveland VA, and university hospitals. They all have collaborations with Case Western Reserve. Each of these hospitals also have full-time clinical ethicists at the hospitals that are doing ethics consultation, that are embedded in these hospitals that understand clinical ethics. And so as part of the core requirements for our master's program, students have to take a clinical ethics rotations course in the fall and then in the spring. And during these rotations, you're going to be spending 160 hours inside one public in the fall and then a private in the spring, or vice versa. It could be private in the spring and public in the fall, at these teaching hospitals. And you're going to be spending time there exposed to all different kinds of healthcare opportunities. So it could be going to different types of rounds. So general floors, ICU units, step-down units. You're spending time with attendings, residents, physician assistants, nurse practitioners, medical students, nurses, other bioethics students. The ICU units are going to be unique to the different hospitals that you're at. For instance, Metro has a burn unit. So the burn ICU unit is unique to that system. The VA is going to have very different patient demographics than the other hospital systems. You're going to see a lot of geriatric patients there. There's a lot of outpatient care there. There's a lot of orthopedic care or mental health care there. So it's very different. University Hospitals has a very large children's hospital. So Rainbow's Babies and Children's Hospital. So it's really great because depending on what hospital you're at, you're going to see unique opportunities. Second category we have is committees. So you have the opportunity to see ethics committees, transplant committees, human or animal research committees. They could be monthly or bi-monthly. They are addressing all different kinds of issues, from policy to patient decision to research protocols. So again, it's this opportunity to kind of dive in and see what happens. And the last category we call one-on-one with healthcare professionals. So physicians, nurse practitioners, living donor advocates, chaplains, genetic counselors, and social workers, and of course others. So I see there's a question about, do you get to choose which hospital you study at? And so the way that it works is we work with students to figure out what makes the most sense. So is there a particular area of medicine you're interested in? Or is there a particular area of clinical ethics you're interested in? And so we work together to figure out which hospital system makes the most sense to be your public experience, so either Metro or the VA. And then for your private experience, either Cleveland Clinic or UH. And then the other thing we also think about is access to transportation. So Metro is the one hospital that's on that list that is not within walking distance or easily accessible via public transportation. So if you weren't to have a car, we wouldn't send you there. And so we think about that as well. So the goal is to get you at 2 of the 4 during your time during the master's program. And so that's what we try to do. So you try to do 1 public and 1 private, and the goal is to get you to compare them as well. So during the single semester, during the 1 semester, you're at 1 hospital for that whole semester. Yeah, but great question. Thank you so much. All right. So yeah, that's how clinical ethics rotations work. They're fantastic. They're probably one of the top reasons students choose our program. You can't beat getting 160 hours and really immersing yourself in the hospital, understanding the ethical issues, the culture of a hospital, meeting with your fellow students, the site preceptor on a weekly basis to really dive into what you've experienced in the last week and think about, the ethics and what that means, and, really consider, all the nuances of a specific case. So that's one great way that we have experiential learning in our program. So Roselle, I'm going to turn it over to you to talk about some of the research opportunities for our students.
Sure. Yes, there are many research opportunities in our department. Many of our faculty do their own scholarship and research, as well as teach and other commitments to the university. And so what I've listed here are some ways in which you can find out more about what they're working on. You can hear directly from the faculty and staff. A lot of them will talk about their work in classes, or if you want to meet with them, we have some of their work up on our website as well. So they're happy to meet with students to talk in more detail about what work they're doing. But we also talk about them at our research core forums, which are bi-weekly meetings with the whole department, which students are also welcome to attend as well, in which we talk about how our work is going, how our research is going, and what is coming up, what's new, what issues we're having. And so it's a way for the faculty and staff to talk to each other about their work. This also comes up in the Works in Progress seminars, which are once a month seminars in which faculty and staff can talk about a research project that they're currently working on. And it's another way in which to see the interdisciplinarity of the department, to get feedback from other perspectives, other disciplines, and other people in continuing to develop their work. The Metro Health, Bioethics at Noon, and the University Hospitals Ethics Grand Rounds are both, the Metro Health one is a monthly program, and the University Hospitals is quarterly, in which other scholars are brought in, or they may also be from within the department, to speak about specific topics that they have been interested in and are working on. And those are great because they're open to the public as well, and the wider community, and you can get really robust discussions of the issues and the different topics from those opportunities as well. And so all these opportunities are ways to learn more about what the faculty are working on, and what kind of research they're conducting, and also to bring in scholars from their colleagues from around the world as well. And so another new thing that we have started doing is having these research skills seminars specifically for students. And these are ways to get exposed to the different specific skills that are used in research. It can be used in student research, but also if you are participating in any of the faculty's work. These are skills and methods that are really helpful for students to know. And so I have been having these maybe once a month or once every 2 months in order to get some specific instruction on these methods and skills. I have tried to bring in speakers from key offices such as the Health Sciences Library and the IRB to give us feedback on what skills you need and what you need to know. During the fall, these focused on literature reviews because this is a big part of doing research. It's to figure out the background information you need and how to develop your research in the wider field. So we devoted several seminars on really how to do literature reviews well, and also to expose you to the library staff who are amazing and can provide a lot of helpful feedback for that as well. And I believe literature reviews are part of the capstone project as well. So I think those were really helpful for students. In the spring, I've been focusing on qualitative research methods. Our department's faculty is really strong on qualitative research methods. We have anthropologists and people with a social science background. And so a lot of our research has included qualitative research methods such as interviews, focus groups, things like that, surveys. And so I have wanted to introduce students to get a little bit of exposure on what those different methods look like and how to do them. And these are helpful not only in participating in the faculty's research projects, but also for any kind of future work you do in research as well. So the specific activities for students, students join the faculty and staff on various projects. And we're always happy to have the student help on these. So the ways that they participate in these is they can participate in the collaborative team meetings. A lot of the research projects include teams We have several staff people working on them. And so they meet regularly as they develop the research question, the research methods, collecting data, and then analysis. And participating in these meetings is a really helpful way to learn about what research is like and what that involves, and can be a really good way to get to know the faculty and staff as well. As I mentioned, literature reviews are just a big part of what we do as well, especially as faculty look into new areas and consider new questions. So just looking into seeing what has been done before is a big part of what gets done. And these can be from very exploratory to really very structured, structured literature reviews, which are very intensive. But students have also been known to participate in data collection as well, including sometimes doing interviews, or if they can't do interviews since it's only a year program, they often will listen to interviews that have been already conducted or read transcripts, and then sit in and participate in some of the data analysis as well. So the whole range of research activities students have participated in our department.
All right. Sorry about that. I accidentally hit the forward button.
No, it's okay.
I will say, as someone who has worked with some of the students or heard from the students, they really enjoy being able to join the faculty and staff on projects. They learn so much, but then, I know hearing from faculty and staff, they enjoy having students on the projects as well. It's very much a mutual benefit, and there's been students who have gone on to, get hired either in our department or, at, other universities because of their skill sets they've learned, or they've moved on, to other educational opportunities, and they go on to those, PhD programs or something, knowing how to do the skills that we've taught them in our department and in the master's program, which is fantastic to go on to. So a lot of that credit goes to the programs you've created, Roselle, for the students. So,
well, some students have actually, even if they've left the program or have finished the program, they have continued to stay involved with the research as well. If it's something they've been really interested in. So that has been always fun to see when something captures their attention in this program, and to stay on with it further.
Yeah, that's fantastic. So the last piece of the experiential learning we just want to briefly mention is our short-term study abroad elective. So these are courses that we offer. They're typically 1 to 2 weeks. They count for a 3 credit hour elective that travel during either the winter break, spring break, or in May. And they're a great part of our master's program. We are very hopeful that in this upcoming academic year, we might be able to offer these again. Of course, it's always dependent on what happens with COVID. But these are great opportunities for students to get to experience travel opportunities, another culture, and do cultural comparisons of bioethics and medical humanities topics with a different lens, looking at topics in Costa Rica, Grenada, Paris, the Netherlands, and even a domestic course in the U.S. National Park System. We had a course a couple of years ago that went to Yellowstone, but there's always opportunities at other national park systems as well. These are fantastic. We're very hopeful to be able to offer these again soon. So I will just briefly mention, if what we talked about has interested you, we would very much encourage you to start an application with us. For those who are ready to submit, the required materials for a completed application include transcripts from undergrad and grad programs. Unofficial are fine for the review process. Submit a statement of purpose. This is 1 to 2 page, talking about your interest in bioethics and medical humanities and how it fits into your larger career path. your CV or resume, and then 2 letters of recommendation, including 1 from a faculty or professor. Once we have a completed application, someone from our admissions committee will review it and someone else will interview you. And then a decision can typically be rendered within 2 to 3 weeks, provided we have that completed application package. It's a rolling admission process, so we can get these done pretty quickly. And of course, if you have any questions about these, please feel free to reach out to us. In terms of our timeline, we are currently taking applications. If you are a current Case Western Reserve undergrad in your junior year, you are eligible for the Integrated Graduate Studies program. That deadline is March 1st. If you have more questions, contact us. Our next deadline is, which we're calling the Priority 2 deadline, is May 15th. That deadline is if you are interested in applying for our student assistantship program, which we talked about, is for students who want to get involved in the teaching, research, or administrative assistantships. In order to be eligible for that, you have to submit a master's program application by May 15th. The student assistantship application is then due June 1st. So just keep those dates on your radar. And then our final deadline for the fall 2022, oh, there's a little typo here, on the fall 2022 start is August 1st. So that's our deadline for this year. And classes will start in August, which seems very far away, but it's not. It will come very quickly. So I want to open it up. I know we are at the end of our time, but if anyone has questions, please feel free to submit in the Q&A and we can answer them. We're happy to take any questions. The other thing I will suggest, if you have questions, please feel free to email us, bioethics@case.edu. We are happy to connect with you. We can either simply answer your question in an email, or we can set up a one-on-one meeting with you to talk about your specific questions, your specific circumstances, or anything that you are interested in reaching out to us. Do we have a cost estimate for the program? Sam, do you know what the cost estimate is? I don't off the top of my head, but it might be easier for us to be able to send that to you.
Yeah, I mean, with all of the different pieces, it depends also what pieces are required from the university, which it doesn't change, but you can elect certain things. So that changes the number. So yeah. I'm going to write down the person who wrote that, and then I will email them after this, after I figure it out.
Yeah, that's an excellent question. It might be easier for us to circle back to you with a clearer answer.
Absolutely.
Yeah, it's a great question though. From a general standpoint, what I can say is Case Western Reserve, our program falls under the tuition and fees that is established by Graduate Studies. So that is where our tuition and fees are set by. Any other questions while we're here? All right. Well, I'm not seeing any more come in. Okay. All right, I'm not seeing anything else. So I will just say thank you so much to Roselle for joining us today to talk about some of these experiential learning opportunities, including especially the research opportunities for students.
Oh, you're so welcome.
So like I said, if anyone has questions, please feel free to email us, bioethics@case.edu. We're very much happy to connect with you in lots of different ways. And hopefully you'll consider submitting an application for us for fall 22.